Mesothelioma is a fast-growing cancer that requires aggressive treatment. This usually involves some form of radiation therapy. Radiation therapy is a cancer treatment that uses high-energy radiation to directly target tumors and cancer cells. By specifically targeting tumors, cancer cells can be killed and therefore reduce the size of the tumor. Radiation therapy may also be referred to as radiotherapy, brachytherapy, implant radiation, or interstitial radiation depending on the type of radiation treatment. Some of the sources of radiation used in mesothelioma treatment, as well as the treatment of many other cancers, are linear accelerators, which generate X-rays, radioactive sources which generate gamma rays, and proton accelerators. Radiation therapy is often given from many different angles to target different sides of the tumor. This can prove more effective in targeting the tumors and therefore have a more significant impact on the tumor. In most cases, radiation therapy is used along with other treatment methods to achieve the best possible results. This usually includes surgery and chemotherapy. A combination of treatment methods is often needed because although radiation therapy is very effective, it does not kill all the cancer cells within the body alone. It is important to keep in mind during treatment that each patient's case is different. Therefore, an individualized treatment plan is necessary and made according to your specific needs. Your treating physician will determine the type as well as amount of radiation needed in your situation. There are complex formulas used to help this decision process that involve tumor size, location, and the types of tumors involved, as well as the stage of your cancer. Radiation therapy can be used as treatment in different ways. Often it is used to try to cure cancer, but sometimes cancer may be too far spread and no longer be curable. In these cases, radiation therapy can still be used as palliative care. This means that it is used to help to reduce the severity of cancer symptoms a patient may be experiencing. Mesothelioma patients with an advanced stage of cancer may find this beneficial in reducing cancer pain and shortness of breath. In incurable cases, radiation therapy can also be used as a life-extending therapy. Although the cancer cannot be cured, the radiation treatment is used for the benefit of extending life as long as possible. Radiation is highly effective in killing cancer cells, but healthy cells are killed and damaged along with the cancer cells. This is what causes the symptoms that you will experience during your radiation treatment. Healthy cells that are damaged or killed during radiation will eventually regenerate themselves. This becomes evident after your treatment with radiation therapy is completed, as the symptoms you experience during treatment will begin to subside. Radiation therapy itself is a painless procedure, though the symptoms can often be very troubling to those experiencing them. You will need to keep your doctor informed of the severity and type of symptoms you are experiencing during treatment. There may be some ways you can treat some of the individual symptoms to ease their severity. There are many symptoms you may experience during your treatment that can at times become quite severe. Some of the most common symptoms include swelling, fatigue, skin damage and skin rashes, hair loss, infertility, difficulty swallowing and loss of appetite, nausea, vomiting, and diarrhea are also often experienced, especially when treatment involves the abdominal area. The number and severity of symptoms that you will experience depends on the type and amount of radiation treatment used, as well as the area of the body. Your doctor will talk with you about what you can most likely expect. However, remember that each individual undergoing radiation treatment experiences their symptoms differently, and they can vary quite widely from person to person. Radiation therapy can be external or internal. External radiation is when cancer cells are targeted with treatments from outside the body. For this type of therapy, you will need a series of appointments that may last for a few days, weeks, or even months, depending on your individual treatment plan. Another form of radiation is called internal radiation therapy, which uses radioactive devices called radioisotopes. These radioactive materials can be wires, tubes, needles, catheters, or beads, and they are placed inside the body as near to the tumor as possible. This type of radiation therapy is often used in the treatment of mesothelioma, as it is effective in killing fast-growing cancer cells. It is also used more often for deeper tumors that may be harder to target from the outside. IMRT is a form of external radiation therapy that is commonly used to treat mesothelioma. This treatment can target tumors better, while sparing normal tissues versus forms of radiation therapy. Remember, radiation therapy will kill many healthy cells along with cancer cells, which in turn creates the symptoms that many patients suffer during treatment with radiation. IMRT is effective in reducing the amount of healthy tissue exposed to radiation, since it can target the tumors and reduce damage to healthy tissue. You may also hear the term combination radiation therapy. This term usually used to refer to radiation used after surgery to target any cancer cells that may have been left behind. Although rare, it is possible that radiation can cause secondary cancers that can occur many years to decades after radiation therapy. Radiation is in itself a cancer-causing agent, though usually the risks involved in the possibility of secondary cancer is outweighed by the benefits achieved through treatment. Sarcomas and leukemia are common secondary cancers associated with radiation therapy. Leukemia or other secondary cancers may prove more difficult to cure. Your doctor should discuss all risks involved with your particular therapy prior to treatment. Be sure to ask as many questions as you need in order to be fully informed of what to expect prior, during, and after your radiation therapy.
Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net, information and help for patients and families.